from this perspective of neurologist, 90% of our examination is visual. So that right there from our standpoint. But also visual training goes beyond just a doctor looking at a patient, making a diagnosis. Along with it comes a type of thinking that goes into differential diagnosis, goes into collaborating with other physicians, and more as medicine is expanding, it's impossible for one physician to know everything, and also one physician to work in vacuum. So we have to work with groups, and the type of thing that goes on during the visual training strategy work in the museum goes into the kind of activities that we have to go through, looking at a patient, making decisions about therapy and physical diagnosis in the hospital. Being in the presence of a patient, even for some of us who've done it for 40 years or so, it's still overwhelming. The patient is overwhelming. The training that takes place with the students in the museum setting, which is by far more relaxed and also in a way less threatening, is so much more conducive to their being relaxed in a thinking situation and then carrying that over to the clinic so that they can evaluate the patient with better confidence in their own thinking.
Well, I think that the observation is very similar. Physicians, non-physicians, it takes practice. It takes suspending preconceptions and biases. It takes experience. And I think one of the valuable aspects of being at the museum, unique aspects of being at the museum, is people who come to Harvard Medical School and all medical schools are a very type A personality, and they always want to be right. And I think it's nice to be able to be freed from this notion that there's a right answer and a wrong answer. And art does that uniquely. It allows people to really explore what they see and converse with other people about it in a free and open way that's not always possible in a classroom.
Great.
In fact, I would say it's rarely possible in a classroom.
It was very cool to see that, you know, when you facilitate an open discussion and keep on saying, like, what more can you find, and encouraging people to dig even deeper, that so many more things can be found beyond what you'd ever expect. You know, it's this idea that many minds together create much more than all of them individually. I'm just much more open-minded when I approach looking at something, and that's going to be very helpful when I'm looking at patients, because we have such limited time, you know, to diagnose anything with patients now that's huge. And I look back, it was absolutely my favorite class in medical school. I cannot imagine going through Harvard Medical School without this course.
Any collaboration between scientists and humanities folks always has a little difficulty because of the two cultures. But coming into it with this acceptance that the other culture does not obey all the rules of your culture, but that the two of you together can do something that is really useful and the outcome is good for patients, should be something that one they have to work at, I think, as we all have had to do. But the outcome is so wonderful that it's worth the struggle to put the two cultures together.
I would plunge in with abandon. You know, you have to try it. It sounds kind of crazy. You're going to get a lot of crazy nods and stares from the students and from the faculty. But that didn't dissuade us, did it? No, we jumped right in. And, you know, I think having a fairly intensive experience is much more valuable than having a pleasant experience, which you can do in one day or one afternoon. And those are good, and I don't want to dissuade anyone from doing that, but I think this program is valuable because of the longitudinal 10-week or 12-week nature, and, you know, collaboration between the art educators and the medical educators, I think, has been fruitful. It's very hard to do this without the art educators, because I think they bring a, you know, extra level of depth and sophistication to what they teach.